Sponsored by Regeneron and Sanofi.
Hi, I'm Annie, and I want to tell you how I started treatment with Dupixent. It was a big decision, but I had help from my mom and my doctor.
Hi, I'm Sue, Annie's mom.
Hi, I'm Dr. Siegfried. I'm Annie's pediatric dermatologist.
So, here's what happened. I had been struggling with severe atopic dermatitis my whole life. When I was in middle school, it was really out of control.
We tried so many things to treat Annie's eczema, including prescription therapies. Nothing was really giving her that long-term relief we were hoping for.
Then, one day, I was having a really bad flare-up, and Dr. Siegfried said, "I think it's time we consider Dupixent."
Because Annie's disease was so severe and couldn't be controlled using several other options, I felt she was a good candidate for Dupixent. I'd been involved in the clinical trials for Dupixent and seen treatment results firsthand. I was really hopeful that it could work for Annie.
After Dr. Siegfried told us about Dupixent, we really needed to think about it. I wanted to speak with my husband, and we needed to do our own research. So we did that, and we talked together as a family to figure out what our next step was going to be.
One of their concerns was that Dupixent would suppress Annie's immune system. I explained that Dupixent's not a steroid or an immunosuppressant. It works by targeting a source of inflammation under the skin that contributes to atopic dermatitis. Dupixent may help reduce this inflammation and the symptoms of eczema to help make her skin noticeably clearer.
Dr. Siegfried was great. She talked to us as people. She explained how Dupixent works. She gave us time to think things over. We trusted her. We knew she had Annie's best interests at heart.
Before I prescribe Dupixent for my appropriate patients, I consider a few factors. How severe is their disease? What other health issues do they have? Generally, when I see a patient struggling with uncontrolled, moderate to severe atopic dermatitis who's not getting relief from prescription topical therapies, I consider whether Dupixent might be able to help them.
I was open to Dupixent as a treatment option. However, I wasn't that excited about how Dupixent is taken. It's an injection, and I'm not really a fan of needles.
After an initial loading dose of 2 injections, treatment with Dupixent requires 1 injection under the skin every 2 weeks or every 4 weeks, based on your age and weight. I told Annie, as I tell my other patients who fear an injection, "You've been through so much already with your eczema. I feel it's something you could become more comfortable with over time."
I became more okay with it once I learned that my school nurse could do the injection for me.
Starting Dupixent was not something I felt I could force on Annie. I wanted this to be her decision.
Yeah, I thought about it. My eczema was not getting better on its own or with other treatments, including topical prescriptions. What I really wanted was clearer skin and less itching. If Dupixent could help me get there, then I was willing to try it.
I was pleased when Annie agreed to start Dupixent. I felt that Dupixent could help her skin heal.
Before Annie started Dupixent, I told Dr. Siegfried about all the medical conditions she had and the medication she was taking.
Make sure you talk to your doctor about the potential benefits and risks of treatment, including the most common side effects, such as injection site reactions, and some serious side effects, such as allergic reactions, including skin reactions that can sometimes be severe, eye problems, psoriasis, and joint aches and pains.
We were so proud of Annie for making the decision to move forward with Dupixent. She was really advocating for herself and taking control of her eczema.
Since Dupixent prescribing information doesn't require ongoing lab monitoring, Annie's office visits are less often. I've heard that she's talked with some of my other patients in the waiting room about her experience.
I'm happy with my decision to start Dupixent. And hey, if I can help other kids as they deal with their eczema, then I'm good.
Important safety information. Do not use if you are allergic to dupilumab or to any of the ingredients in Dupixent. Before using Dupixent, tell your healthcare provider about all your medical conditions, including if you have eye problems, have a parasitic Helminth infection, are scheduled to receive any vaccinations, You should not receive a live vaccine right before and during treatment with Dupixent. Are pregnant or plan to become pregnant. It is not known whether Dupixent will harm your unborn baby. A pregnancy registry for women who take Dupixent during pregnancy collects information about the health of you and your baby. Are breastfeeding or plan to breastfeed. It is not known whether Dupixent passes into your breast milk. Tell your healthcare provider about all the medicines you take, including prescription and over-the-counter medicines, vitamins, and herbal supplements. Especially tell your healthcare provider if you are taking oral, topical, or inhaled corticosteroid medicines, or if you have AD and asthma and use an asthma medicine. Do not change or stop your other medicines, including corticosteroid medicine or other asthma medicine, without talking to your healthcare provider. This may cause other symptoms that were controlled by those medicines to come back. Dupixent can cause serious side effects, including allergic reactions. Dupixent can cause allergic reactions, including skin reactions, that can sometimes be severe. Stop using Dupixent and tell your healthcare provider or get emergency help right away if you get any of the following signs or symptoms: breathing problems or wheezing, swelling of the face, lips, mouth, tongue, or throat, fainting, dizziness, feeling lightheaded, fast pulse, fever, hives, skin rash, including rash that looks like a bullseye, or painful red or blue bumps under the skin, general ill feeling, itching, swollen lymph nodes, nausea or vomiting, joint pain, or cramps in your stomach area. Eye problems. Tell your healthcare provider right away if you have any new or worsening eye problems, including eye pain or changes in vision, such as blurred vision. Your healthcare provider may send you to an ophthalmologist for an eye exam if needed. Psoriasis. This can happen in people with atopic dermatitis who receive Dupixent. Tell your healthcare provider about any new skin symptoms. Your healthcare provider may send you to a dermatologist for an examination if needed. Joint aches and pain. Some people who use Dupixent have had trouble walking or moving due to their joint symptoms, and in some cases needed to be hospitalized. Tell your healthcare provider about any new or worsening joint symptoms. Your healthcare provider may stop Dupixent if you develop joint symptoms. The most common side effects in patients with eczema include injection site reactions, eye problems, including eye and eyelid inflammation, redness, swelling, itching, eye infection, dry eye, and blurred vision, cold sores in your mouth or on your lips, and high count of a certain white blood cell, eosinophilia. Tell your healthcare provider if you have any side effect that bothers you or that does not go away. These are not all the possible side effects of Dupixent. Call your doctor for medical advice about side effects. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Use Dupixent exactly as prescribed by your healthcare provider. It's an injection given under the skin, subcutaneous injection. Your healthcare provider will decide if you or your caregiver can inject Dupixent. Do not try to prepare and inject Dupixent until you or your caregiver have been trained by your healthcare provider. In children 12 years of age and older, it's recommended Dupixent be administered by or under supervision of an adult. In children 6 months to less than 12 years of age, Dupixent should be given by a caregiver. Please see accompanying full prescribing information, including patient information.